There's an alarming trend now when it comes to lung cancer. Doctors say more and more people are being diagnosed with the disease despite never having smoked cigarettes.
News 4's Un Yang has more on a D.C. woman's surprising diagnosis and the message she wants you to hear.
Jennifer Randolph thought she was doing everything right. She's active and healthy, but something felt off.
I had a very annoying pain in the middle of my chest that I was trying to chase down for over a year.
She went to a cardiologist who ran tests, but the results brought even more questions.
We could not find the problem, and you have to work the problem until you find the answer, and that's really important.
The D.C. woman says she went to specialist after specialist until a CT scan led her to her diagnosis, stage 1 lung cancer.
I've eaten right my whole life. I have exercised my whole life. I am not a smoker, and here I am. So your mind goes through several different questions. Is it environmental? Was it something that I was eating? Is it stress related?
Jennifer's story is part of an alarming trend with 10 to 20% of lung cancers now diagnosed in patients who are non-smokers.
It's something that has everybody in thoracic oncology, which is the study of lung cancer, very worried. In the sense that we do not know who the high-risk people are, so we don't know who to screen.
Dr. John Lazar is the chief of thoracic surgery at MedStar Washington Hospital Center and says women, particularly Asian women who have never smoked, face a higher risk of developing lung cancer than men. The reason why isn't clear, but some factors may play a role.
Part of it may have been prior exposures, maybe secondhand smoke. We do know that the number 2 cause of lung cancer is radon exposure. So another thing that people can do is if they spend a lot of time in their basement or they live in an older home is to make sure that they get radon levels tested in their basement.
He says the key is early detection, looking out for symptoms like a cough that won't go away despite antibiotics, fatigue, or unexplained weight loss. As for Jennifer, she had surgery this summer to remove the tumor in her lungs and says she's getting stronger and more active each day while sharing her story to warn others of the risk.
Follow your head here and listen to your body, and don't take no for an answer.
Now, Jennifer Randolph says her grandmother had lung cancer and never smoked either. Researchers say they're working to learn more about the role genetics plays in all of this. Lung cancer remains the leading cancer killer in this country, with more than 130,000 people dying every year.